Hello all, very good morning. In today's class, I would like to discuss you regarding the job functions of an health worker male, and we are going to discuss remaining community health nursing personnel job responsibilities and their job description. So yesterday we have seen regarding the job responsibilities of an A&M nurse, and now we are going to check out the remaining members of this community health nursing personnel team. So here, male health workers job responsibility, they are more and less as same like female health worker. So here the male health workers were almost equal to the female health worker. So whatever the work that was assigned for the female health worker, the same works will be assigned to this male health workers also. But the thing is, the male health workers, these workers were not utilized in the maternal health related activities. So they mainly concentrate on the environmental health. They mainly focus upon the communicable and non-communicable disease control and their surveillance, and they will mainly focus upon the delivery of national health programs to the community. So here they are mostly used in the national control programs like malaria, filaria, leprosy, dengue, chikungunya, and temporary and permanent contraceptive methods for the male, but not female. Here for females, the female workers are mostly used, and for males sometimes the female workers can be used, but most of the time the males will help them. Coming to the job responsibilities of a staff nurse. So here she involves herself in the reproductive and child health programs, that means nothing but RCH related activities, and she also participates in the conduction of deliveries and episiotomy. She supervises the facilities and immunization activities. She supervises and facilitates to work for the health workers of both male and female. So these are some of the job responsibilities for the staff nurse. So she provides training for the subordinates. She takes responsibility of conducting sub-center OPD. So outpatient department services were conducted by the staff nurse, and she ensures and promotes quality in all services that were delivered. So coming to the job responsibilities of an health educator here. So what is the job responsibility of an health educator means? So it is desirable that every PHC need one health educator. Why? Because in order to promote the health education, in order to improve the knowledge of the patients who are coming, even the working personnel, so he or she functions under immediate administrative council of PHC of the medical officer. So here immediate administrative control of the PHC medical officer. So here the health educator is mainly working under this PHC medical officer, and he or her job is to health educate the people. Coming to the job description here, so they uses the information to develop the activities of the block for a program planning, especially for the health as well as family welfare. So they are mainly focusing upon planning of health and family welfare. So they develops work plan in consultation with medical officer who is responsible for this PHC, and also the block extension educator. So they collect, they analyze, they interpret the data in respect of extension of education work, and the maintenance of records of educational activities and tour programs. So all these are some of the responsibilities for this health educator. So they also assist the medical officer in conducting health camps for the health workers as well as ASHA workers. So they conduct the classes here mainly, and they also train the health workers. And nextly, they organize the health days and weeks and publicity programs. So they are the one who organizes the health days. They conduct the orientation training program for the health as well as family welfare workers. So those who are working in the health and family welfare sector. So in order to educate the people, first of all, these people should gain some knowledge. So these people, they were mainly trained by these staff nurses. And nextly, opinion leaders and local medical practitioners, school teachers, dayas, and others are involved in this family and health welfare work. They assist in the organization of mass conducting programs. So whenever they want to conduct programs, so these people will help there. These health educators also will help. They supervise the field work performance in the area of education and motivation. So as these people are training the personnel who are working in the community level, so these people are very responsible for their worker performance, whether the workers are able to treat the patients or not, able to motivate the patients or not. So they will check, they will supervise, and they will guide them. They verify the eligible couple and they will register all the contraceptive methods for the family planning, which they are using, either permanent or temporary. So these health educators, they communicate with the depot holders whether the kits were available or not, whether they are enough or not. They will communicate with the health workers as well as ASHA health workers. Nextly, they help in field workers to overcome the resistant cases and dropouts in health and family welfare programs. As a health educator, it is their responsibility to maintain complete set of educational aids that were used for the family welfare as well as training purpose. So what are all the instruments that were used, what are all the equipment that were used, they maintain that set of instruments so that whenever they are teaching, it will be very effective and it can reach the audience. So public education and health educational sessions in schools they will conduct. They will maintain the list of acceptors who accepted for their family planning methods, and they send a monthly report and progress of educational activities in the particular block to the higher authority, and they participate in every health promotion related and IEC activities. So these are all some of the roles and responsibilities of health educators. Coming to the job responsibilities of health assistant female worker, means lady health visitor or female supervisor. So here health assistant female, she is covering the population up to 30,000 in plain areas and 20,000 population in tribal and hilly areas, and she is responsible for at least 6 sub centers. So here the health assistant female, she will carry out the following duties. So what are all the duties that were carried out means here, firstly supervision and guidance. So she supervises the health worker female dayas delivery of healthcare services to the community, and nextly she mainly shows interest in strengthening the knowledge and skills of health worker female, and nextly she help and guide the health worker female in helping in planning and organizing her programs of activities. Nextly, she visit the sub center once a week on fixed dates and guide the health worker female in her day-to-day activities. And nextly, she assesses the work of the health worker female through the reports. So what are all the reports that were given by the female health workers? She assesses those reports, and so that whenever there are required changes or whenever there is knowledge deficit for this female health worker, she supervises her, she guides her, and she brings her into correct position. Nextly, she supervises the health worker female during their home visits. So whenever they are doing home visits, whether they are doing accurately or not, or whether they are able to motivate the family or not, whether they are able to show the intent to the family or not, they will check everything and they will guide accordingly. And she also supervises the pregnant woman for the RPR testing at PHC. So mainly she refers whether they are getting the referral or not, whether they are getting this test or not, she will check. Nextly, she participates in teamwork also. She helps the health workers to work as a part of this health team. And nextly, she coordinates their activities with those health assistant male and other health personnel including the DAYA. So what she does, she mainly coordinates so that the outcome is good. So whenever all the health personnel are working together, then only the outcome will be good. So it is her responsibility to coordinate with everyone, and she coordinates the health activities of agencies and attend the meetings at primary health center level, and she conducts regular staff meetings, so with health workers as well as with health workers with both male and female, so that they have a coordination, they have a coordination. And she attends staff meetings at PHC. She assists the medical officer in PHC. So whenever they require any kind of data, she brings the data which were collected by these health workers, either male or female, so that the required data can be taken from this female health supervisor or female health assistant. Nextly, we have she participates in mass camps and campaignings in health program. She facilitates and participates in the activities of health as well as on the village health as well as nutritional day. And nextly, coming to the supplies, equipment and maintenance of sub-center. So here she works in collaboration with the health assistant male. She checks the stores in sub-center at regular intervals, mainly towards the procurement of supplies and equipment, and she gives drugs and supplies at subcenter whether they are checked properly or not. So she is the one who is responsible. So she checks properly regarding the expiry date, regarding the distribution of the drugs, and nextly she ensures that the health worker female maintains her general kit, whether they are maintaining their general kit or not, whether they are maintaining their midwifery kit or not, and dia kit they are maintaining or not. She is the one who is responsible, and if there is any need for them, she has to replace them with the particular need. She ensures, means she is the one who is responsible for the cleanliness of the subcenter. She is the one who is responsible for records and reports keeping, and she scrutinizes and guides the record maintenance of health worker male as well as health worker female, and she reviews and consolidates the reports of health worker female. So here in Kala Azar endemic, additional duties are like she is the one who should check randomly minimum 10%. So whether the houses were visited by the female worker or not, whether they are being skipped. So whether the checking for the suspect of Kala Azar cases, whether they are receiving the complete treatment or not, she has to check. She is very responsible and she is accountable for the patient to receive complete treatment for this Kala Azar, and she should ensure completing the coverage of spray activities in search operation and health education activities. Nextly, she should participate in training. So she should organize, she should conduct training for Dayas as well as Asha workers with the assistance of health worker female or male, and she should assist the medical officer in the female in primary health centers in conducting mainly the training program for various categories of the health personnel. Coming to the maternal and child health activities, so she should conduct MCH clinics at each subcenter. So she is the responsible person for conducting these OPDs, and she should provide help, what are all the necessary help that is required by the female and male health workers. She should provide them and she should guide them. She should guide and she should train them. She should train even Dayas also, and she should conduct deliveries when they are required at the PHC. So if they are done at home setting, she is the one who should go and check them, and if they are conducted at PHC level, she is the one who should conduct the deliveries at PHC level, and she should provide domiciliary as well as midwifery services. Coming to the family welfare and medical termination of pregnancy, so she is the one who should ensure, she should spot check the health worker female, and she should maintain date eligible couples register at all times. So if there is any requirement for the medical termination of pregnancy, she is the one who is very responsible. She should conduct weekly family planning clinical duties. Whenever she is conducting these maternal child health services, she should even conduct this family planning clinics, and she can take help from the health worker female, and she should personally motivate and resistant case for the family planning. She should provide information. So what are all the available information that is present, and what is the availability of equipment for this medical termination of pregnancy, all these things should be explained by this female supervisor or health supervisor. She should refer suitable cases for the MTP, get approved and to go for the medical termination of pregnancy. So as a guide health worker female in establishing, she should guide the health worker female in establishing female depot holders for distribution of these contraceptives, and she should train the depot holders with the assistance of health worker. She should provide IUCD services and their follow-up, nothing but intrauterine devices, and nextly intrauterine contraceptive devices, and nextly she should maintain their follow-up. That is her duty. She should assist the medical officer in PHC whenever they are organizing the family planning camps. Nextly, nutrition. So she is the one who is responsible to find out all the below 5 years children, and if they require any necessary treatment, she should give the treatment. If it is serious, she has to refer them to the PHC. So iron folic acid supplementation should be distributed to the beneficiaries. She should educate the expectant mother regarding the breastfeeding, and nextly universal immunization program. So it is the main responsibility of the supervisors, and you should supervise immunization of all pregnant women and the children who are below 5 years of age, and she should also guide this multi-purpose workers male. So either it is male or female. So whenever they are conducting the immunization program and whenever they are conducting the guide, she should guide them to maintain the cold chain storage of vaccine, health education, immunizations. So all these things she should use. She should supervise the immunization of all pregnant women as well as the infant, and she should follow the directions given in the manual of health worker female under the immunization program. Nextly, acute respiratory infection. So she should ensure that the people who are getting this pneumonia cases, they should diagnose as early as possible, and they should get treatment as early as possible, and if it is required, she should refer the cases for the higher center. Coming to the school health, so it is her responsibility to assist the medical officer of PHC in school health services, and if there are any minor elements, and so she can treat those minor elements, and she should provide oral rehydration therapies, ORS, and first aid, and in case of accidents and emergencies, she should refer the cases which were beyond the level to the nearest PHC hospital, and she should give health education. So health education in every aspect, in communicable diseases, non-communicable diseases, maternal health services, in every aspect she should give health education. So, and lastly, she should utilize the members of Mahila Mandal, teachers, ICDS workers, and other women in the community in the activities that were related to family planning program or family welfare program. So these are all some of the responsibilities of an health supervisor or lady health assistant. So with this, we have completed the job responsibilities of a male health worker, female health worker, and health supervisor. So these are all some of the job responsibilities. So if you like the content, please like, share, and subscribe the channel. And I have discussed the job responsibilities of all community health nursing personnel in my previous classes. I request you to go and check those classes also, so that you can have clear data. Thank you so much. Thanks for watching, and if you have any queries, drop them in the comment box, and any suggestions for me, please drop them in the comment box. Thank you so much. Thanks for watching.